Al Jazeera Podcasts.
Hey there, it's Samantha. Now, if you're loving Now You Know, make sure you spread the word. Share this episode or your favorite one with your friends or anyone who needs a dose of women-powered wisdom. Every share helps grow our amazing community of listeners. And don't forget to subscribe and leave us a review. It makes a world of difference. Now, let's dive into this week's episode.
For years, I've been going back and forth to doctors about my stomach issues, and they would just say it's anxiety, it's stress. Just lose weight was the biggest one. Just lose weight, just lose weight, just lose weight. Nobody had bothered to check my thyroid function.
Like many women who advocate for their health, Ayah Jaghoub was told she was being dramatic by doctors when she knew something was wrong with her body. She was told to lose weight, and that would fix her problems. But it didn't. Her health kept declining until finally she was diagnosed with 2 autoimmune diseases and thyroid cancer.
For the most part, thyroid cancer is a silent disease, meaning that it's really asymptomatic. So there are no major symptoms.
Now, thyroid cancer is 3 times more common in women than men. So I want to know, why did it take us so long to get diagnosed? And how does thyroid cancer impact women differently to men? I'm Samantha Johnson, and this is Now You Know, a new series from Al Jazeera dedicated to amplifying women's voices, stories, and topics we're all thinking and talking about. This is a safe space where we go all in, so by the end of each episode, you can say, "Now I know." Ayah was diagnosed with thyroid cancer when she was just 23 years old. 2 years on, you could say she's been on quite the journey, and she's here with us to share her experience. So, Ayah, thank you so much for joining us on Now You Know.
Thank you so much for having me. It's an absolute honor to be your first guest in studio. It's beautiful. I love it.
We like it. This is going to go well. I can feel it.
Me too.
So we're obviously here to talk about your health journey, and to say that it's been quite the experience is an understatement. How are you today?
I'm wonderful. I'm absolutely fantastic. I've been documenting my health journey to actually bring awareness to it. So it just feels amazing to start off my year being able to actually speak about it, and versus last year where I was freaking out like, am I going to die?
We've got a lot to talk about. So let's go through your journey and your difficult year. Can you just tell us what it was like, what you were thinking, how you were feeling?
I was terrified. I don't think anybody would go into an experience of having cancer of any kind and not be. I'm still in my journey. I still have treatment to go. But it was just, I realized I can't be physically sick and have time for anything else mentally, whether it be socially, whether it be anything. I just need to make space for me and myself.
You need to focus.
Absolutely. And I need to ground myself and come into myself and just put into perspective life in a way that I can't even describe. So as crazy as it sounds, it was the best thing that's ever happened to me. Also because I learned so much about myself, about the world, how to advocate for myself as a woman, as a young woman in the medical industry. It's been interesting to navigate, to say the least, but it's been something that I feel like I was very unknowingly prepared for. And everything came to fruition, I think, in the way that it needed to.
So tell us what your life was like up until you were diagnosed.
Chaotic. I'm an artist, so I didn't know if I wanted to stick with makeup, which is what I was trained in, or if I wanted to do textiles, which is what I grew up doing and what I love doing. I wasn't doing the best with my mental health either, so everything was just kind of one thing after the other.
When you say your mental health, what do you mean by that?
I'm autistic and I have ADHD, and I was diagnosed with autism relatively late as a woman, so 22, ADHD when I was 9. So there was just a lot of not understanding how to regulate myself, not knowing what I wanted with my life, lots of very unbalanced emotions or reactions to emotions, I would say, that I just couldn't figure out how to regulate or self-soothe. And then it was just, I was diagnosed and everything came to a halt, and I was like, oh, okay.
So you were diagnosed with thyroid cancer.
Yes.
How did it come about? Just talk us about that moment when that happened.
It's a very silly story. So it actually happened over 6 months.
Oh, wow.
So for about 3 years, I was obese for quite a bit of my life. And I had spent 3 years losing weight purposefully, and I lost about 70 kilos. And within 6 months, I had gained back 30. So in those 6 months, my grandmother was in the ICU before she had passed away. And I had gotten a UTI from the stress. And so I just gone downstairs to the ER, and the doctor, just in passing, was like, "Your neck is swollen. I'd like to scan it." And I was like, "Dude, I've got enough going on. Like, please, please." He was like, "No." And then he insisted, and I'm very grateful they did, because they found 2 tiny nodules. But at the time, they weren't a concern. So in the back of my head, I was like, this is going to be something. But I just did not have, I was grieving. I was going through it. Just couldn't deal with that. Like, it was just like, whatever. They said scan it in 6 months. And I completely forgot about it. And so with the weight loss journey, to bring it back to that, I had been seeing a plastic surgeon to get rid of the excess skin. And I just kept gaining it. And he was getting a bit surprised. I was on quite a strict regime that I was following. And so at one point, she was like, "I'm just going to refer you to the endocrinologist in our clinic. And either you're going to get on a shot, or we're going to figure out what's wrong with you."
So you were there for one thing, and then they found something else.
The reason for all of my health issues, I was diagnosed with 2 autoimmune diseases after that as well, just one thing after the other.
Was it all interconnected?
Oh, yeah. So I have familial Mediterranean fever, which I was most recently diagnosed with. And typically it affects your kidneys the most. For me, it seems like it was definitely or a role that it played in my cancer. And I have Hashimoto's as well, which is an underactive thyroid, where your body creates antibodies. It doesn't recognize your thyroid and it starts to attack it. So he referred me to the endocrinologist. They did blood work and an ultrasound. And immediately there's a Thyroid scale, which is how they differ cysts from tumors. So 4 and 5 are way more likely to be cancer, and all of mine scored 4 and 5. So immediately he was like, "I need you to go get a biopsy done ASAP." And I did, and they're like, "It's papillary thyroid carcinoma." It was not just papillary thyroid carcinoma. It is the most common form of thyroid cancer and is known as the good cancer. Yeah, it's the cancer that everybody wants, because everybody wants cancer, yeah.
How did you feel in that moment when someone's saying to you, "You know what, it's okay, it's the good cancer"? Because all you're hearing, I would imagine, is the C word.
Actually, my aunt, I'm very grateful for her. She said it in a way that was the most reassuring, which is, no cancers are easy, but if you were to get any of them, this would be the one that is going to assure you the most. Like, this isn't going to be easy for you, but you're going to be fine. But in my mind, I was just going, what are you talking about? It's cancer.
Can you tell us what you were experiencing and what symptoms you had up to your diagnosis of thyroid cancer?
Weight gain was the biggest one. 30 kilos in 6 months is quite a massive undertaking, especially after the weight loss. Brain fog was a massive one. Emotional dysregulation. I had a lot of stomach issues, just either a lot of pain, a lot of irregular BMs, if you will, just irregular everything, lots of bloating, lots of swelling in my face. I just kind of ballooned for quite a while. And so my double chin was very prominent, even as I was losing weight for a little bit before the weight gain started to kick in. At one point, I just could not sleep for a week. Heat and cold intolerance, mostly heat intolerance, which is opposite to what a lot of people do go through. Yeah, those are the main ones.
And why did it take so long to get diagnosed with thyroid cancer?
I wish I could tell you. For years, I've been going back and forth to doctors about my stomach issues, and they would just say it's anxiety, it's stress. Just lose weight was the biggest one.
Oh.
Yep, just lose weight. Nobody had bothered to check my thyroid function. I've been having symptoms of both the autoimmune diseases and which obviously were affecting my thyroid before the cancer since I was 12 years old. And I wasn't diagnosed until I was almost 24. I was a month shy of 24.
Look, you know your body, you know your own mind, your own feelings. How did it feel just going from what it sounds like, going from doctor to doctor to doctor and just feeling like you're not being heard? How did you get through that?
I didn't. Frankly, I was losing my mind. I was very depressed. I couldn't deal with it. Because at one point your body just becomes so overwhelmed, just crying and screaming for help. I will say, shout out to my psychiatrist. Keep your mental health in check.
Hey.
He was definitely a huge part of my journey and being able to keep me steady. But I just spent most of my time sleeping. I spent most of my time just making art, essentially, because it was all I had the energy to do. The low energy, the exhaustion was the biggest part of my symptoms. And as a result of feeling like, so am I the problem? Am I just, is it all in my head? Because at some point you get gaslit so much that you just can't help but feel like, I have to be making this up at some point. When I was diagnosed, I felt relieved.
You were right all along. You were vindicated, basically.
Oh my God. Have you seen Brooklyn Nine-Nine?
I know of it.
There's a scene where Captain Holt just screams, "Vindication!" And that is genuinely how I felt the day I was diagnosed. I was just like, I'm not crazy. Like, I'm not crazy.
You knew it all this time.
I'm not insane. Something was wrong with me. You have to laugh about it.
I'm glad you can, because I'm just, look, I commend you 1,000 times over, because I don't know how anyone can go through that. Because it's not just the physical aspect as well. It's the fact that you've gone from doctor to doctor. And you know all of this time that there's something wrong. Hello, come on, find it. Come on, work with me here. You've gone through all of that at such a young age.
You gotta get through it by going through it. It's just about, like, it's either be miserable or figure it out. I was absolutely livid for a while. Just how could nobody? It was obvious, and like the lumps were very obvious too. It was very.
Yeah, I'm looking at your neck now, and I've got to say, when we first met, I didn't notice the scars. So talk us through it all. I'm talking like this now.
That's okay. So this is the reoperation scar, actually. So my first scar is a bit lower, and it's much lower than where a thyroidectomy should. It's this one right here. It's supposed to be at the very crease of my neck, not in my sternum, between my collarbones. So my first surgeon had definitely screwed up. In my first surgery, I felt like something was still wrong, and he was like, it's just a swelling. Before I had even left the hospital, my incision was infected. He had left in 7 tumors. The scar tissue...
Left in 7 tumors?
Yes.
You're supposed to get all of them out?
Yes. It had spread to both my right and left side, and to behind my bones. So where the first incision was, there were tumors right behind them, and he had just not been as thorough as he should have been. So we didn't find this out till August.
So the surgery was in January, and you didn't find out until August?
Until how bad it was. So we did find out in April, after my first round of treatment, that there was definitely a portion of my thyroid that was actually left in. And so the treatment process is radioactive iodine. So your thyroid is what processes and is what takes in iodine in your body. So from the salt and dairy and eggs and anything that you consume in your diet, you need iodine. Your body is starved of iodine for treatment, so you are on a very strict diet. And then they deliver the medication. It's a localized treatment, so it's not like chemotherapy or radiation. They turn the iodine radioactive, and immediately any excess thyroid tissue picks it up, and then your body flushes out the rest. So you do a radioactive iodine scan. It's a full body scan. It's a gamma ray scan. So they see where the radioactivity has picked up. And once we did that, there was just 7 glowing orbs and a nice big strip. I had referred to my treatment as getting nuked more times than I should. But if you don't laugh, you'll cry.
Say, I loved your warped sense of humor.
Thank you.
Because I kind of think, I don't know if I was in that situation, I don't know what I would do or could do. But I know I have a sixth sense.
If you don't laugh, you'll cry.
If you don't laugh, you cry.
Yeah. So I told him, I was like, there's still something left in me. I can feel it. And he was like, you are the first patient to have ever told me exactly where everything is, what's wrong. How did you know? And I just looked at him and I said, exactly. I know my body. I can feel it, by the way. When they opened me up, they had to operate on 7 different parts of my neck and chest, completely from right behind my ear all the way down to the base of my neck. And then they were behind. So there was 4 clumps. They had found that the first surgeon had done such a horrible job that the scar tissue had fused to the tumors, wrapped around my airway, and was choking me. They had also started me on the very wrong dose of levothyroxine, which is synthetic thyroid hormone. And I went into hyperthyroidism, which almost led me to a thyroid storm, which nobody wants. Thyroid storm is when essentially your whole body just starts crashing.
So what does life look like now? Because you went through all of those treatments in 2024. How do you live without a thyroid?
You're on medication for the rest of your life, which is okay. I still have not found my right dose, and I still do have treatment in February. But I can tell you life is a lot better. I don't know if everybody would agree with that. Initially, not having a thyroid, the hormone dip, the changes in your body, it controls every single part of your body. It has an impact on everything.
Mm-hmm.
And for the first month, I just felt like, is this what it's like to have a normal body-ish? Is this what it feels like to have clarity? Is this what I felt my creativity starting to come back.
Wow. Finally, what advice would you give any woman who is going through something similar, whether it's thyroid cancer, I don't know, just any ailment?
Do not reduce yourself to, it's okay, it's just this. That's my first one, is do not minimize yourself. Do not make yourself smaller to fit into somebody else's expectation of what you should be, how you should be handling it. You know yourself and you know your body. And if something is wrong and you know it, no matter how many people try to quiet you down, scream louder. And the second one is, you are not your illness. You are not your illness. You are not your cancer. You are not whatever is going on. You are yourself first and foremost.
Ayah Jaghoub, we're blessed that you are actually sitting here with us today. Thank you. And look, I appreciate you for being so open and honest about your whole journey, because let's be honest, it's not easy, but you did it, girl.
Thank you so much. Thank you so much for having me and allowing me to speak about it.
Okay, now that you've heard Ayah's story, let's hear from Dr. Tania Jabber, who's an endocrinology consultant at Hamad Medical Corporation here in Doha. Dr. Tania, thank you so much for joining us on Now You Know.
My pleasure. Thank you for having me, Samantha.
Okay, so we've just heard from our first guest, Ayah, about her story when she was diagnosed with thyroid cancer and diagnosed with Hashimoto disease. I kind of want you to just break it all down for us and actually just tell us, what is a thyroid?
All right. Perfect. Let's start there. So a thyroid is one of our endocrine glands. It's a butterfly-shaped gland, and it sits right at the base of our neck, down here. So a lot of people come and they say, my thyroid's swollen. So this is, up here is not your thyroid. So our thyroid is down at the base of the neck, and there's a right side, a left side, and the isthmus connection to it. When we talk about diseases of the thyroid, we typically talk about diseases that affect the function of the thyroid, and then diseases that affect the structure of the thyroid. And oftentimes these are two separate things. So when we talk about, disorders that affect the thyroid function, so we're talking about hypothyroidism, of which Hashimoto's is the most common, and that just says it's an autoimmune disease. Basically, your own body is fighting your thyroid and causing it not to function appropriately, and causing your thyroid hormone levels not to be adequate in your body. And then hyperthyroidism also can be caused by other autoimmune diseases that affect the thyroid. And then when we talk about structure of the thyroid, we talk about thyroid nodules, which are basically benign growth of the thyroid, and then thyroid cancer, which, as most of our audience know, cancer is just an abnormal growth of cells. And so depending on where it arises from, it gets labeled that way. So thyroid cancer is just an abnormal growth in the thyroid, mostly caused by abnormal thyroid cells.
What is the function of
the thyroid?
Of the thyroid,
so the thyroid releases thyroid hormones, T4 and T3, that affect the metabolism of the body.
Right.
So they really regulate most of our metabolism, and not just metabolism when we say about things like weight gain and weight loss and my metabolic rate. So that's obviously part of it, but also metabolism of all the organs. They affect our lungs, they affect our heart, our brain, our function, our muscles. So really, it's a very necessary organ for life, and we cannot live without it. And that's why people who have a little bit of abnormality in their thyroid, whether it's hypothyroidism or they've surgically removed their thyroid, need to take those hormone replacements because thyroid hormone is essential for life.
Okay. So when we talk about thyroid cancer, how does it come about?
In terms of what causes thyroid cancer, when we talk about risk factors, there are risk factors that are outside of our control. So, for example, women are more likely to get thyroid cancer than men, but that is what that is. There's nothing you can do about it as a woman.
Why is that?
Why is that? We think that maybe the female hormones, so the estrogen, may have some cross talk with the thyroid cells. And so because women naturally have higher estrogen levels, with pregnancy as well, estrogen levels go up. And so that may be the cause. But again, there's nothing proven that you can do anything to change that. But what we know that is modifiable is radiation. So exposure to radiation, and we're not talking about, X-rays here and there. The radiation that we're talking about is mostly childhood radiation, so exposure to radiation and childhood. So children who, unfortunately have got maybe lymphomas or leukemias as children who had to undergo radiation, we do see that there is an increased risk of thyroid cancer in those patients. Also, like radiation in terms of, like, for example, survivors of Hiroshima. So few, 5, 10, 15 years down the line, and even until now, we are still seeing an increased risk of thyroid cancer in that population that was exposed.
So is there ever a feeling that when it comes to women and when it comes to our diagnosis, the medical field just doesn't really care that much?
There's such robust research on thyroid cancer, especially recently. So if you maybe had asked me that question 10, 15 years ago, I would tell you not yes because of the woman, but yes because, thyroid cancer is a very, thankfully, indolent disease. The mortality rate, meaning that it's a very slow growing, it's a very lazy cancer, if we want to put it in layman terms. So meaning that not many people die from thyroid cancer. Thyroid cancer has a very, very, very low mortality, despite the rates of thyroid cancer increasing. So in the early 2000s, we saw a surge of thyroid cancer cases. However, the mortality remained very low. But it also tells us another thing, is that perhaps early detection doesn't really affect mortality. So even though we're diagnosing more cases, we're not really affecting the survival of patients because it's already great.
Ayah said something really interesting when they diagnosed her. They said, you know what, don't worry, it's the good cancer. So why do doctors say, okay, this is the good cancer? I mean, is that the best terminology to use?
So, I mean, between us, doctors, like if we typically would say, if I had to get a cancer in my life, I would probably pick thyroid. It's completely curable, it's treatable. I shy away from, as you said, putting good and cancer in the same phrase.
You automatically think it's the big C.
Exactly. And again, the weight of cancer, you also don't want to minimize what patients are feeling. So you hear the word cancer and you're freaking out, and you have the right to freak out because again, you're young, you're healthy. So cancer, whether it's going to, whether it's curable or not, is going to be life-changing. You're going to be seeing doctors more often than you anticipated. You're going to be having more procedures than what you had, thought about. And you're going to be now on medications that maybe you never thought you'd be on, chronic medications this young. So it's life-changing, and we don't want to minimize that. But as I said, it's a lazy cancer, meaning it's very self-growing. It often doesn't like to extend beyond its comfort zone, which is the thyroid. And so it gives us time to diagnose, it gives us time to manage, it gives us time to follow up. And we often give this example as well. Like, for example, if a pregnant woman comes to us and she was diagnosed during her pregnancy with thyroid cancer, we can often wait until she's delivered, breastfed, before operating, before treating. Obviously she would need monitoring to make sure things aren't advancing. But, oftentimes we can wait.
Yeah, that's leads nicely to my next question, because obviously treatments are going to affect men and women differently. So can you just tell us how treatments would affect women differently?
Yeah. So the treatment of thyroid cancer, and when I'm I think let's just preface our conversation by stating that we are going to talk about the most common kind of thyroid cancer. There are many kinds of thyroid cancer, which is what we say the differentiated or papillary thyroid cancer. And so the treatment of papillary thyroid cancer, which we'll refer to as thyroid cancer from here on, is 3 approaches. So first is surgery. We have to remove the cancer. So oftentimes that entails removing part or all of the thyroid gland, depending on where the cancer is. And then thyroid hormone replacement, as I said, because thyroid hormone is essential for life and we need it. And then what we refer to as radioactive iodine. In terms of thyroid hormone replacement, it's quite the same between, men and women. And then from the radioactive iodine aspect. So radioactive iodine makes use of the fact that the thyroid is the only gland in our body that uses iodine. And so by labeling iodine with a radioactive material, so a little tiny radiation, what we are allowing is, it's a pill or a drink that you take, and then this iodine goes to your thyroid, and the little radiation component will kind of wipe off any extra cells that were not being able to be removed by surgery. So this is, amazing.
Yeah.
And, now for people who follow cancer and targeted therapies, like this was probably the first kind of targeted therapy that ever, affected, again, making use of the unique physiology of our body and the fact that thyroid uses iodine. So radioactive iodine, because of the radiation element in it, can affect women more so than men, especially women who are thinking about pregnancy or are pregnant or are breastfeeding. So we cannot get pregnant for 6 months after the treatment with radioactive iodine because of the residual radiation that may be left in the body and its effect on the growing fetus. Also for men, by the way, they shouldn't conceive, or they shouldn't get a woman pregnant for 6 months after. In terms of pregnant patients already, or patients who are breastfeeding, so we cannot give radioactive iodine. Of course, for pregnant patients, again, because of the risks of the growing fetus. And then with the radioactive iodine for breastfeeding women, it's excreted in all bodily fluids, of which, breast milk would be one. And so typically in those instances, and, depending on the specifics of the thyroid cancer, in most cases, we allow the woman to carry her pregnancy, deliver, breastfeed as long as she wants.
Wow.
I mean, within reason. And then we would go ahead and give the treatment.
Ayah told us her story and what symptoms she experienced leading up to her diagnosis. What should women look out for?
For the most part, thyroid cancer is a silent disease.
Wow.
Meaning that it's really asymptomatic. So there are no major symptoms. In certain patients, they do, and depending on where the location of the cancer within the thyroid is, sometimes they notice like difficulty swallowing, or like, as if something's getting stuck, like, I'm trying to swallow, it's getting stuck. There are lots of nerves. So the thyroid sits right in front of the left side of the thyroid sits right in front of the esophagus, our food pipe.
Yeah.
And so that's why if the cancer is in that part of the thyroid, it can sometimes cause that sensation, or like that clearing throat sensation. Like I always feel like something's like scratchy or itchy or something like that. There are also all the nerves in the neck that go to other places, and a lot of the times people have like ear pain actually, or shoulder pain even, if that thyroid cancer is irritating a nerve nearby. In more advanced cases, some people feel swelling of the thyroid, like, they could feel localized swelling or a lymph node that's, popped up or something like that. But in most instances, as I said, it's what we say incidentally discovered, meaning that, patients go in because they have back pain. They get an MRI, for example, of their spine, and then something pops up in their thyroid.
And she also told us that she, suffers from Hashimoto's. Is there a link between the two?
So as I mentioned, Hashimoto's is an autoimmune disease of the thyroid that affects the ability of the thyroid to produce enough hormone to sustain the bodily needs. So there is a link. The studies are a little bit conflicting. So there have been many studies that showed that there is an increased link of Hashimoto's with thyroid cancer. And then there are other studies that did not show that link. And there are some studies that showed that, the kind of cancer that's affected in the thyroid is the thyroid lymphoma. So it's not really a cancer of the thyroid cells, it's the cancer of the lymph cells in the thyroid.
And what about other autoimmune diseases? Are there any links? Because she also spoke about, was it familial
Mediterranean fever. Yeah,
fever.
FMF, familial Mediterranean fever. So the link with FMF and thyroid cancer is probably not there, but the link with FMF and Hashimoto's is there. So again, FMF is an autoimmune disorder, meaning a disorder of our immune system. Patients who have, we all know that patients who have one autoimmune disorder tend to have or are more likely to have other autoimmune disorders.
Once a patient is diagnosed with thyroid cancer, what are the next steps?
So once you will probably be diagnosed with a thyroid nodule first.
Okay.
Meaning that there is a growth that has been noted on your neck ultrasound, and most probably, a biopsy would be recommended, a biopsy of that nodule. If, your physician is recommending a biopsy, it means that, they're seeing something on the ultrasound that we just want to make sure of, even though, 95% of thyroid nodules are benign. So more likely than not, you have a normal growth of the thyroid, but because of maybe the size or the shape or how it looks, a biopsy is recommended. Once a biopsy is done and the thyroid cancer is confirmed, then a surgery would be discussed with the patient. And so again, the extent of the surgery, whether all of the thyroid or just half of the thyroid is removed, depends on how it looks on the ultrasound, its size and all that. And then after the surgery, we'd follow up with their endocrinologist, like their thyroid doctor, and they would most probably be on thyroid hormone replacement. Not everybody requires radioactive iodine therapy, again, depending on what we find in the surgery, like after the surgery biopsy results. And if so, again, your doctors will walk you through it. And then after that, it's a matter of just monitoring. So in that first year, you probably will get ultrasounds every 6 months, and then every year, along with some blood tests as well.
So after you're diagnosed, you said that you're pretty much on medication for the rest of your life. What does that look like?
Yeah, great question. Yeah, so thyroid hormone replacement, yes, you will need it for the rest of your life because, as we said, the thyroid is an essential gland for our body. Thyroid hormone replacement is a pill. It's a tablet. Maybe in the community like Euthyrox, levothyroxine, Synthroid, so different brands, but it's basically a tablet that you take on an empty stomach.
Is that a daily thing as well?
It's a daily.
Okay.
So the thyroid hormone, it's hard to absorb it from the stomach, and that's why we can't mix it with other foods or other tablets. So it might be also an adjustment for certain people who wake up and have to reach for their cup of coffee immediately. But we have some, tips and tricks for a patient.
Dr. Tania Jaghoub, thank you so much.
Thank you so much.
For your insight, your
pleasure.
expertise, and just for being here.
Thank you so much. That was my pleasure. Thank you.
So now you know how thyroid cancer impacts women and why it can go undetected for so long. A huge thank you to Ayah Jaghoub and Dr. Tania Jaghoub for joining me today. And of course, a very special thanks to you for watching and listening to Now You Know.